I really enjoyed working here in Royal Melbourne Hospital ICU. We got a really big supportive team, warm culture, and heaps of great patients. Because this is my very first job in Australia, I don't know how things work out here. English is not my primary language. Would I be hard to communicate with all the patients, all the team members here? One word to describe Royal Melbourne Hospital ICU, that would be multicultural.
I know how nerve-wracking it is to start a new job, let alone come from overseas to start a new job. I became a SMART mentor because it seems like a really fantastic way and program to support people to make that transition into a new workplace just that little bit easier.
Here in Royal Melbourne ICU, we got SMART program for newly joined critical care registered nurse.
Learning how things work, learning what resources there are and the policies and procedures of how things are done here at the Royal Melbourne to get the hang of things probably more quickly than they would if they were in an unsupported sort of situation.
One thing that really surprised me is the relationship between different professionals here, especially medical staff and also nursing staff here.
When Bernard first started with me, I remember one of the first things that came out in the first couple of shifts was that he was very unfamiliar with being able to liaise with the medical staff freely about concerns he might have had or questions he might have had about his patient's treatment. And I just encouraged him, at any time throughout the shift, if you've got any concerns, that the medical staff want to be notified and you are part of that conversation.
They ask about nursing staff's opinion, and we are really formulating a plan for the patient together. And I feel really respected. They really involved us. And after the plan's been formulated, they will always ask, "You happy?" I really love that. I am happy that you involved me.